Hey, Dr. Mike here. If you or a loved one is suffering from chronic venous insufficiency, listen, nutritional therapy can really help.
You're listening to Live Foreverish, a show dedicated to helping you live just a little longer. Here's your hosts, Dr. Mike and Dr. Crystal Gossard.
All right, welcome to Live Foreverish. So, Dr. Crystal, varicose veins, spider veins, some swelling in your ankles and calves, all this could be a sign of what's called chronic venous insufficiency.
Yes, it's an advanced stage of chronic venous disease, and the blood's just not getting back up to the heart. It has to fight gravity, and that's not happening.
Yeah,
as well.
Yeah, and so we mentioned the spider veins. Those are just like little wispy-looking veins, discolored. Varicose veins are that's a step up in the disease process. But there's also could be redness, some swelling, tenderness, that kind of stuff can go along with that as well. And other things can come with that as well. Maybe not as common, but a lot of people with chronic venous insufficiency, they talk about how their legs get fatigued faster.
Yeah.
Right. There may be some cramping, even some tingling. There's a whole list of things that kind of go with this. But at the end of the day, like you said, the blood's just pooling. It's not going back up to the heart where it's supposed to be.
Yes, and we know that symptoms may worsen later in the day with heat, standing for long periods of time, especially if you're not walking. And then women, it may be worse during your menstrual cycle.
Yep.
So it's very common. I think we should probably
it's
put that out there.
It's
extremely common. And many people have just a mild form of this, but it can progress and get worse.
Yeah, and you can distinguish, the lower limb swelling and stuff from other causes like heart and liver and kidney, because as you said, if chronic venous insufficiency gets worse during the day. It doesn't. Like a lot of people with heart failure, right? They're always swollen.
Right.
Right?
Yes.
And it's a different type of swelling, too. We're not going to get into that. Whereas chronic venous insufficiency, in the morning, it often looks totally normal.
Yes, and so other kind of signs that something is going on, I think about this if you get a massage, let's say, or let's say you go to get a pedicure and they start doing the leg massages and it's tender and it kind of hurts. That's a sign that maybe this is something that you're dealing with. And it is more than just a cosmetic deal, because there are a lot of these vein clinics. It's a cosmetic thing for many people where they just don't want to have the varicose veins or the spider veins showing. They want their legs to be just nice and
you have
pretty.
The valves you just kind of mentioned, right? These are one-way valves, and so the way the blood moves from your lower limb up back to the heart is muscle contraction. And these valves allow that blood to go back, but then they're supposed to stop any backflow. Well, these valves just get old.
It's just like everything else in the body.
Yeah.
It's a thin little valve. And so inflammation, oxidative stress,
all that stuff. Yeah.
That can all cause damage to those valves.
And it doesn't take much. Once that valve allows some of that blood to go back down, that's the pooling and stuff.
Well, I think that you also have to think there are multiple valves. That's leading up, and
one.
There's like a set of valves that's more in the superficial, closer to, I guess, the outside, and then there are the valves that are in those deeper veins. And once you have something happen with one valve, they kind of work as like I think about them as the doors on a subway or like the trains where you see like one opens and you keep walking and the other opens, and it's just trying to direct the traffic of that blood. And when you have one that malfunctions kind of further up, now it's putting pressure on the one below that and then below that, and there you have it.
There are certain risk factors, right? Genetics can play a role here.
Yes.
Generally speaking, in increasing age, for all of us, right? Someone who's tall.
Body height, that's more pressure.
Yeah, more pressure and longer for that blood to go. Right? Being overweight or obese. Like you already mentioned this, female and even pregnancy. And of course, it's a risk factor for everything. Smoking.
I know.
It's on the list for everything. So there you go, right there. If you're smoking, we got to get you off that.
Yeah.
That's going to be helpful. All right, so let's get into nutrients that can help, right? Because that's how I started this. Like if you got some of this stuff, that's all background information, just to give you some. But at the end of the day, people want to know what can they do.
One of my favorites, sweet orange peel extract.
Diosmin.
Yeah. It's a flavonoid antioxidant, and we can get it from the citrus rind.
It's really interesting because it seems to play a role in vein integrity. And I'm not sure if we know. I mean, we know it's an antioxidant in general, so that right there helps, right? But I've heard that there's more to it than just being an antioxidant. I don't remember all that research, but it is. I like that because it's helping vein structure, which is important.
And I think what you're thinking has something to do with neurotransmitters and like working with the sympathetic nervous system.
Yeah, it was something like that.
And so yes, we do know it's helping with that, and it's supporting a healthy inflammatory response. And it's one of the kind of tried and true nutritional solutions.
Yeah.
A micronized form of this flavonoid is a drug in other countries. And then here in the U.S., we can, use it as a nutrient.
Right. It has been in use for chronic venous insufficiency in other countries for decades. This isn't something brand new. This has been around. It's just it's time it gets popular in the United States. That's what I think. And I think it is. I think more and more people are hearing about it. Let's talk about the study.
So this is a 2024 study highlighted in the journal Annals of Vascular Surgery. And the study type is a retrospective analysis of data from files of patients with chronic venous disease at an outpatient clinic. So again, going back, looking at files from those patients. And the files that the researchers include 721 patients with chronic venous disease. And the intervention, 1,000 milligrams of that micronized fraction, basically the micronized diosmin, orally once daily, plus compression therapy for 6 months. And those are the compression stockings or socks.
Yeah. Did we tell them what micronized means?
I didn't.
It's just a fancy way of saying it's a big compound, right? And so you got to break it up a little bit, and that allows just for better absorption. And that's it. That at the end of the day, that's what it means.
Yep, small, micronized. Yeah. And so the results here, and the researchers use kind of imaging and of the vascular system, the veins, and saw increased venous refilling time and increased venous pumping capacity. All of these are kind of markers of improved venous valve function. And again, if we can support those valves, then we can make them stronger, help them to keep the blood in their little compartments.
Yeah, I like this because it's targeting one of the underlying problems. Mechanisms, which is vein integrity in the valve. So, diosmin, top of the list.
Yes.
Number two. Now this has been around a long time too, and it has some good research. So that's why we have it at number two. It's horse chestnut.
Yes, and so what is horse chestnut? Did you know it's a tree?
It's a seed.
Type of tree.
It's a seed from the tree,
and it's a seed from the horse chestnut tree.
Yeah, it's not a horse.
No.
It's a tree, Alex.
The active ingredient is eskin, And it supports a healthy inflammatory response, manages swelling like edema, and improves vein wall tone.
Yeah, and this was actually it's been shown to improve calf spasm, leg pain, itching, fatigue, some of that stuff we talked about at the beginning. There was a review of 17 randomized trials. That's good.
Cochrane database, systematic review. Big
17
time.
studies, so that's really good. And all of those, when you put it together, concluded that horse chestnut seed extract was associated with overall improvement in signs and symptoms of chronic venous insufficiency in comparison with placebo.
And leg pain improved in 6 of the 7 trials, and leg volume improved. So we're talking, let's think about what your legs look like after a long flight.
Yeah, they get a little swollen.
They get a little swollen. So if you're seeing the volume improving, that means that the blood is not pooling.
Yeah. So there you go. That's horse chestnut. Number 3, this is another nutrient that could help. If anything we're talking about sounds like you, this is another one, and it's nattokinase.
I love natto.
Have you ever
Not eating it.
Not eating it, yeah.
No.
Oh, it's so rough.
But it's an
rough.
enzyme. So first of all, natto is fermented soy.
Yeah.
Fermented soybeans.
It looks like baked
Slime.
beans that are like in worm slime. Yeah, it does.
So we're talking about an enzyme from this, but they're not white beans. I mean, baked beans. I think about like
it just looked like it a little bit to me.
Okay, don't Google it because then you won't want to add this in. But it's an enzyme.
We're not
from
eating
natto.
that. We're taking the enzyme nattokinase. Why are we doing that?
It helps to support it interferes or not interferes. It works in the clotting pathway so that your blood is thinner.
Yeah.
And is flowing better.
Yeah. Because you don't want to when blood pools, it will clot.
Well, one of the mechanisms of chronic venous insufficiency, some of the, I guess, pathophysiology behind it is that you have a clot in one of your deeper veins. And then that trickles down into impacting those superficial veins.
Yeah.
And so if you could just support healthy circulation, that helps to support pressure in those veins and help to manage this.
For sure. Then it was studied, but I want to move on to the next one.
Well, let's give them the dose.
Give them the dose.
100 to 200 milligrams daily. With natto, look for at least 2,000 fibrinolytic units. Those are like the fibrin that the natto breaks down.
It's the
in
enzyme
the clotting
activity.
process.
Yeah. Okay, let's now move into pycnogenol, French maritime pine bark extract, right? We've talked about this one a lot.
We have.
And we've talked about it in the context of cardiovascular health, brain health, skin.
I think
we
so.
do
That's
a
what I'm
show on
thinking.
skin.
We had a doctor on talking about, I believe it was skin. I was thinking hair, but maybe it's
maybe
skin.
it was hair too. I can't remember, but no, it's fantastic. It does a lot. It's a workhorse of the nutrient field.
It also works to maintain a healthy clotting process. Relaxes blood vessels, supports inflammation, stabilizes collagen.
Which
we know
helps.
our blood vessels are made of collagen, and it's great.
86 patients with severe chronic insufficiency received 150 milligrams or 300 milligrams of pycnogenol or 1,000 milligrams of Daflon, which is your diosmin. Yep. And they were given that for 8 weeks. At the end of 8 weeks, improvement in chronic venous insufficiency, as assessed by several measurements, was greater among those receiving pycnogenol.
Receiving the diosmin.
Who received, yes. Yes.
So basically, we're comparing. We talked about diosmin as our first nutrient drug in another country. And so this study is comparing pycnogenol,
To
which is
diazepam.
also,
Yeah.
I mean, the number of studies on using this pycnogenol is fantastic. So we're comparing two tried and true head to head. The pycnogenol won out.
Yeah. Why not do both?
Well, you can.
You can.
And the dose for that pine bark is 100 to 200 milligrams daily, pycnogenol.
So there you go. Some nutritional therapies for chronic venous insufficiency. Hopefully this was very helpful for people because there's not much out there in conventional medicine.
Yes,
There's not.
There's ablation. I mean, there are different
There's
procedures.
different things, but if
that
you don't want to get to that
Yeah.
level, at least try some of these nutrients
well, you could always get up and walk.
Walk and take the nutrients.
Movement,
Stop smoking.
exercise. Get those calves. Do some calf raises.
You do that. I see at your desk doing that all the time.
Yeah.
All right, there you go. Some nutrients for chronic venous insufficiency. Don't forget, you go to liveforeverish.com. You can download, like, and share many other podcasts and topics that are of interest to you. And you know what? Our sponsor,
Life Extension
go to lifeextension.com and use the discount code
podcast.
for 10% off, $50 or more, plus free shipping and handling. That's at lifeextension.com. I'm Dr. Mike. That's
Dr. Crystal.
Thanks for listening.